Dr. Jonas Apostol.
Hi guys, it's August and it's rainy season. So, grabe, it's really complicated when it comes to the weather ngayon. I don't know, there's a lot of people out there na nagkaroon ng mga colds. It's because of the sudden change of the weather. Mainit, tapos may malakas na ulan. So, yeah. So, stay safe lang and you have to take your vitamin C just to make sure that strengthen your immune system. And also, you have to take care of your body because it's very important. Health is wealth. Anyway, now we have opened our own big space here at Electra house. It's actually located hundred steps away from the old clinic. No, so it's a 550 square meter space. So kabilang dito, we have our 7 operatories, dental laboratory, and then lounges. And I hope I will be able to see you all here, like yung gusto mo pa schedule. So yeah. So this is my new setup for vlogging. This is actually my VIP room here in my new clinic. Ito na, I mean, hindi na siya yung last time. So, dito na ako vlog sa VIP room. So, yeah, I love the place. It's really spacious this time. And we're gonna tour you sa clinic na bago. So, watch out. So, let's move on to the case itself. Okay? So this patient went to my clinic with the chief complaint of having a hindi na daw siya masaya with a smile. No? So she's on her late 20s. She's actually getting married and she's based abroad. So she has a month for everything, like for the vacation, and then doon na gagawin, like the wedding will be held here in the Philippines. So it's also part of the preparation will be the smile makeover because she wants to have a confidently beautiful personified smile before going to the altar and sharing IDs to her beloved. So kaya siya pumunta sa akin. Very, very interesting case. So this is the before picture. As you can see here, a lot of things that need improvements. So, number one, she has this 7-year-old anesthetic porcelain fused to metal crowns, which creating some shadowing of the gum area, and also there's a little bit of space in there so food can easily enter and thereby compromising the natural structure of the tooth. The smile is quite asymmetrical and the shades are more opaque, especially on the two front porcelain fused to metal crowns. And also the sizes is a bit off, so we are going to change the whole thing into a more balanced and symmetrical. So as you can see here, the soft tissue is a bit asymmetrical, especially in the two upper central incisors. So since the patient has low lip line, we don't need to do some crown lengthening or lifting the two central incisors in the upper. It will not really matter because we have to consider also the mobility of the upper lip and also the totality of the face. So for this case, there is no need for us to lift the two central incisors. So prior to any smile makeover, we have to make sure that we get all the proper diagnostics. We are talking about panoramic X-ray, the impression cast, also assessment clinically, just to make sure that there is no infection, there is no periodontal problems. So health is very, very important before we consider restoring the teeth or the smile. So for this case, I did a direct composite smile design. I designed it directly to the patient's mouth just to make sure that we give the symmetry, the proper color, and will allow us to create the balance na makikita without the influence of anesthesia. But it's always case to case when we do this kind of designing. It's because there are some cases that it's too bulky, then we can do something about it because we need to remove a lot from that particular tooth or teeth. So for this case, it is suitable for me or for the patient to do a direct composite smile design so that we can be able to check all the details. So after that, simultaneously on the very same day, we did the preparation we did the removal of the old crowns. So you have to take note also that it's always case to case. When we remove old crowns, sometimes there is no guarantee, even though the result of the x-ray would tell you that there's no infection, but sometimes due to the micro leakage, it actually damages the sound structure of the teeth and thereby affecting the tooth structure and proliferating to the pulp. So sometimes super lapid na it's encroaching the pulp. So we have to consider that as well. For this case naman, mabuti wala pang problem. So when we remove the old crowns, there are some cavities but it's not too big. So that's why hindi siya subject for root canal treatment. So tuloy-tuloy lang yung naging flow namin. So for this case, I opted not to do crown lengthening to lift the gums on the two front teeth. As what I have mentioned, it's because of the dentofacial aspect. It does not give me an impression to do that kind of additional treatment kasi hindi naman siya talaga ganon ka-important. What we are trying to achieve here is the health of the gums, the health of the teeth, and also the beauty of the teeth that would be in harmony with the patient's face. We just did a plain teeth preparation, removal of the old composites, build-ups, and also we made sure we have created a sufficient margin for us to make sure that there would be no micro leakage para ma-seal siya together with the cement to be used for the final cementation. So after preparation, took the impression and everything, like all the system I have in my ceramic systematic approach, like yun na siya. Like after completing, endorse it to our in-house, our own laboratory, okay? So lahat doon, like the one that I made, clinically the design, they will copy it in the laboratory just to make sure that they give the same height, diameter, the width, everything that I require for the completion of the case. And also we are making sure na we incorporate some nuances of the natural teeth, like the stains, the glazing that would look translucent.
1 week later.
So after 7 days, patient came in and then we did the try-in. So syempre we have to make sure that the design would match the smile design that I did the last time. So yun, nung nakita na, the patient saw it and she was happy about the result of the try-in. Then we did the final cementation of the ceramics. So this is the after we cement the ceramics permanently. So the material used is zirconia, and it's a combination of crowns and veneers. And as you can see here, we have incorporated some natural nuances of the teeth, and also it's symmetrical, especially the length of the two front teeth and the lateral as well as the canine and premolar, medyo mas even na. It follows the curvature of the lower lip. It's not that big, it's in harmony with the face, as well as the brightness of the veneers or the ceramics suits well with their skin tone. So as you can see here, the gums of the central incisors looks really healthy. There's no shadowing of the metal like what you've seen from the before image. Right now it looks really healthy and natural, and the height of the ceramics fits well with the overall structure. And also the side profile of the patients looks good because of the serrations of the ceramic, and also it's not that bulky. Okay, we made sure that it should look very natural and in harmony with the profile, side profile of the patient. So I gave her the 8-unit combination of veneers and crowns. It's because we are looking at the distal extent whenever she smiles. So we need to make sure that it would look symmetrical, and also the color should be almost the same. Because the existing color of the canine and the premolars are really yellowish. So if we want to enhance the brightness, then we have to consider also the most distal teeth na nakikita when the patient smiles. There you have it. That's the final result of the smile transformation using Zirconia, veneers, and crowns. She's more confident about herself, especially for this kind of occasion. See you all again in my next vlog. And thank you very much for tuning in. And hope, for those who can relate, hope to see you here soon.